Chaffee, Dr. Anthony Chaffee. He's got a channel, and I've seen a good bit of it. And one of the, we're here at Low Carb USA, by the way. We'll be doing a few of these vertical shorts or YouTube short live, like we do on the Friday rant. Dr. Chaffee, one of the things that I've seen about your content recently is that you've been on Carnivore for quite a bit, but there may have been some changes. And one of the questions that we have on our channel quite a bit is we hear different definitions of carnivore.
Yeah.
Can you give me your thoughts on what you think carnivore is, and maybe why there's some differences in definition?
Well, there's different. Yeah, I don't think there's any one hard set way to define it. It's really just eating meat and eggs and animal products. But animal products, I think that you should still keep and maintain you in a state of ketosis. So if you drink a lot of milk and carb-containing dairy, then I can kick you out of ketosis. I think that's actually important for us to be in ketosis. Eating things that, another way to put it is something that my friends over at Paleo Medicina refer to it as a Paleolithic ketogenic diet, which is what were Paleolithic people eating 50,000 years ago during the Ice Ages. It's a lot of fatty meat, and what existed during an ice age in the Arctic Circle 50,000 years ago, 100,000 years ago. That's what you should focus on, because that's what we're most biologically adapted to. And we have more recent biological adaptations and genetic adaptations for persistent lactase enzyme, for instance. Most children will lose the ability to make lactase after, and actually that drives weaning. But we've had that persistent because when the megafauna died out and we needed another fat source, we needed more nutrient sources that we weren't getting from woolly mammoths and giant sloths and things like that. We started using dairy, and people had to start having that persistent lactase enzyme. We had more recent developments of being able to break down starch, and that's sort of a more recent addition as well. So we have these recent adaptations, but what were the original ways that we were eating 50,000, 100,000 years ago before those more recent adaptations? And so that's sort of what I consider the carnivore diet, is that Paleolithic ketogenic diet where you're just eating meat, you're just eating fatty meat. But adding in eggs and butter and those sorts of things I think is fine. I do try to avoid anything with carbohydrates, so I don't drink milk. Dairy I think is a bit of a gray area. There are good things in dairy that are good for you. Very positive, especially if you're eating a mixed diet or a vegetarian diet. Dairy is amazing. But they have very good things, but they have, like, casein can be very pro-inflammatory. So some people do very poorly with casein and the inflammation it causes that comes from dairy. Carbohydrates, I think, are a bit of an issue. They can also cause an increase in your appetite, and you sort of have compulsive eating, so people can overeat. If you're only eating meat and you're only drinking water, you can listen to your body's hunger signals just like every other animal on earth. If you're eating carbohydrates or other sorts of things that can derange your hunger signals, so you can overeat. Dairy can do the same thing, so you can overeat eating dairy as well.
So to your point about dairy, full-fat cream, cheeses, even those have some challenges.
Yeah, they have casomorphins, which can trigger a hunger response, and which makes sense. You have a baby, an infant mammal that it's really important to get a lot of energy in, and to grow very quickly at that stage, so that they can survive and they can get up to a bigger weight and size. But as an adult, you don't necessarily need that same growth driver. Yeah.
Right.
And so that can derange your hunger signals. If you're only eating meat, only drinking water, you can listen to your body's natural signals, and it can change with dairy and other sorts of things. And the carbohydrates. This is also something that they used to give to pigs back in the 1930s and 40s. There were papers out about livestock management saying that giving pigs grains with skim milk, that was a byproduct of the cream and butter industry. It was just sort of a throwaway product. No one drank skim milk, really. They give that to pigs, and that helped bring up the weight of the pigs because it just drove their hunger. And that's what they said specifically in those papers in the 1930s, was that giving them skim milk along with the grains, which is basically breakfast cereal, right? That actually drove the hunger
that's
signal.
The truth.
You know, yeah. And so
in our book, that's the number one worst meal that's done more damage to my generation, the boomer generation, than anything else.
yeah, I would tend to agree
Breakfast
with that.
cereal.
Yeah.
And that's Dr. Vega. He works on our channel.
Good to see you.
Just trying to get you both in here. There you go.
And do you have a mic, or is it picking up from the phone?
It's picking it up from the phone. It's just a technology that we've tried to set that up a little bit differently, but right now we're doing low tech.
Yeah, no, that's fine. So yeah, so that's the thing. So people would have would give skim milk and grains to pigs, and that drove the hunger signal. That caused them to overeat. And that's what they said in the 1930s papers, that this caused them to overeat. And so they ate more, so they put on more fat and more weight, and got a heavier animal that gave them more money and a better product, so to speak. And so, that's something that can happen with us. And so, the carbohydrates can drive hunger because it raises insulin, suppresses leptin, things like that, and drops your blood sugar, so now you're feeling, oh, I have to eat. And then also the casomorphins that can also drive hunger as well. So it's just something to consider, something to keep in mind. And when you sort of refine out a lot of those things, you get down to butter, and especially ghee. There aren't as many of those in there anymore, but prior to that, you still have them. And I think that it's probably as important what not to eat as what to eat. You have to eat the meat, you have to eat the fat. That's very important for your health.
Yeah.
That gives you all the nutrients that you need, but also it's important what not to eat, because there are a lot of things, as we just saw with Dr. E, there are things that actually cause harm, and you have to avoid those things. And so my hard rule for myself is no plants or mushrooms, no sugar or any sweeteners, and nothing artificial. And that will go for sauces, seasonings, and drinks as well. And so for me, it's just whole food meat approach with water, and that's it. That's the best, I say.
So Dr. Vega has made me promise to ask everybody, what do you think is the biggest development in the low carb community right now?
Well, as far as like research, or what do you mean?
Mental health is a big deal.
Well, yeah. So I mean, yeah. Well, there are many advances in the. It's great to see more of these large studies in humans being done, especially in the mental health industry, where you're seeing people reverse things like schizophrenia, bipolar disorder, major depression. That no one ever thought that was going to be something that could just change someone's diet, and all of a sudden they stop seeing things and hearing voices. I mean, no one was ever going to guess that. But that's what we're seeing, and we're seeing that in clinical trials, and now we're seeing this. We're doing these larger randomized controlled trials being done over at Harvard with Professor Chris Palmer, and so we'll see what those say. But from word on the street is that they're so far getting very favorable results, and that's what we saw previously to that too. So I think mental health is a huge one. We've already shown that diabetes can be reversed in clinical trials, and now with Virta Health, they showed that in their published work, and now they've reversed over 25,000 cases of diabetes. Other groups have done even more than that. And as a result, in Australia, which I think is a huge step forward, Dr. James, who's a friend of mine, got on the panel for the guidelines for diabetes, and he pushed really hard for the ketogenic diet to be put in the guidelines. And he got a lot of pushback. Yeah, and who knows if these people had ties with industries, food industries or drug industries. But anyway, a lot of pushback. But he fought really hard for it, and he got onto the guidelines. And so now that the official guidelines in Australia for the last 3-4 years, and that protects a lot of people like myself who practice ketogenic metabolic therapy for our patients and see these results. And because now it's guideline medicine, it's guideline-based medicine. So this is the mainstream now.
Yeah.
And
good point.
It's been so successful in Australia treating diabetes that this past year they've just named it as best practice for treating diabetes, the ketogenic diet. So that's a huge step forward.
That is big.
And so so getting this in the
Now,
guidelines.
who named that? Which guideline?
In the Australian I forget what the
neat.
board is called. But yeah, so it's just the official guidelines for the Australian government.
It's interesting. A lot of our recent views are coming from Australia.
Yeah.
Just out of the blue. I have no idea why.
Yeah, well, it is growing. That understanding is growing in Australia, and especially with doctors and clinicians, that this is an extremely powerful tool to use for your patients.
Very good. Anything else to add for our viewers?
It's just it's a new field, but it's not really. I mean, we have decades and decades, really a century of work on ketogenic diets and how ketogenic diet was specifically brought forward as a medical intervention for neurological disorders such as epilepsy and migraines and diabetes. That was the first treatment. That was the only treatment for diabetes 100 years ago. And then we were able to isolate insulin, and we were able to use that, and everything sort of went sideways from there. But that was the original treatment for diabetes, type 1 and type 2, was ketogenic diet. So this is a rediscovering of what we are. You have people say, "Oh, the wisdom of the ancients." Like it's kind of true in some things. Like this is something that people knew about for a long time. People would have people fasting for epilepsy, and we just saw what George Heath said since 500 AD. So this is something that people understood and they knew about for a lot of these issues. And with the advent of pharmaceuticals, which revolutionized things in a lot of very positive ways, also papered over a lot of things that we understood about nutrition and lifestyle that had significant benefits to our health, and it just completely overshadowed everything and just forgot about it. Because we have a pill for that now, so don't worry about it. And we stopped in those lines of investigation as well, and so we stopped researching that. Professor Thomas Seyfried at Boston College, he's one of the top researchers in ketogenic metabolic therapy for cancer, has over 150 peer-reviewed publications on the subject. And when he was doing his postdoctoral research at Yale, it was in the neuroscience department, and he was researching ketogenic diets for epilepsy, and this was, again, the original treatment for epilepsy for 50 years until they came up with pharmaceuticals. And the head of his department said, that's a dead-end line of research. We have pharmaceuticals now, they work really well. Don't worry about that. So they actually steered him off of that. And so how many other people got steered off of that line of research as well? So it's a rediscovering of a path we've already been on for centuries.
Gary Taubes' book, Rethinking Diabetes.
Yeah.
I'm just rereading it, and it's that very same thing. It makes me think of your comment about, quote, curing diabetes. I always had an argument with that because if you fall off the wagon, you're still going to have insulin-resistant receptors. But there's so much more to the metabolic processes than just the insulin resistance itself. I mean, you really are curing the disease components.
Yeah, well, that's the thing, is that, can you say that you've really cured someone with lead poisoning because you eliminate the lead? Well, if you just start eating lead again, then you'll get lead poisoning again. I was like, all right.
That's a really good point.
But because that's
really
the thing,
good point.
we have to think of this in a different context. I mean, that's why I think of these.
Well, and glucose is a poison for people with insulin resistance, just like lead is a poison for everybody.
And it causes insulin resistance as well, eventually.
Yeah.
And so that's the thing, is that we have to stop thinking of these things as diseases. They're not diseases per se, they're toxicities and malnutrition.
Yeah.
The toxic buildup of a species-inappropriate diet and a lack of species-specific nutrition, namely too many things we're not supposed to eat and not enough things we are supposed to eat. Really interesting. This has been widely studied in animal livestock because animals cost money, and so if the animals start dying and they're not getting up to weight, you lose money. So it's actually very, very strong research in livestock medicine, extremely robust. That's something that Peter Ballerstedt will be talking about here at this conference, and he's a very interesting guy on this. But in veterinary medicine, livestock medicine, there's an entire field of livestock medicine that has to do with nutritional deficiencies and toxicities. And there are all these diseases, big head, limp neck, crazy cow syndrome, big tongue. They're diseases, but they're not diseases. Like that disease is some sort of pathological state that we manifest certain symptoms and signs. but we understand them as that cow got into the wrong forage because they basically ran out of the right forage and they were moved somewhere. Yes, and they eat the wrong plants that they don't have the robust defenses against, and they get poisoned and they get some sort of, so big head is you get this big lumpy nodule head. It's from oxalate poisoning. So they get in things that are way too many oxalates. It actually starts breaking down, stripping calcium out of the bones because it strips calcium out of the blood. And they start like reforming. It's almost like Paget's disease, where they have these big, lumpy, thick.
We can get that too. It's just a little bit different.
Well, that's it. I do wonder, with things like Paget's disease, someone who's genetically susceptible, and then they get oxalate exposure, and then they get this.
Too good. Especially if you see that model in animals.
Yeah, and there's more.
Very interesting.
So there is something called nutritional, what is it? Muscular dystrophy in cows. It's exactly the same disease as muscular dystrophy in humans, but they figured out that it comes from a nutritional deficiency from selenium. Has anyone ever asked if muscular dystrophy in humans comes from a selenium deficiency in the genetically susceptible? I don't think anyone has. And so I've been sort of putting this out into the universe that people, when they come across a kid with muscular dystrophy, maybe check them for selenium or another nutritional deficiency, because we all, selenium is a trace element that almost no one checks for.
Yeah.
But almost everyone's deficient. To some certain extent, and so it's that you can see that manifest in cows, and we can see it manifest in a lot of things. When we put cows in feedlots or pigs in feedlots, we give them a bunch of grains, they fatten up. They get intramuscular fat called marbling. Well, what do
Which is what we get. We call it
steatosis.
Yeah,
That's
exactly
it.
right.
So it's a pathological sign of
Pre-diabetes and diabetes.
Yeah, with association with.
We give them diabetes in the feedlot.
Yeah, exactly. Well, we do, and the thing is too, they also get heart attacks.
Oh, really?
So, yeah,
I didn't know that.
And there was another thing I just saw more recently, where they giving vegetable oils, seed oils to cows and livestock. I think it was back in the 60s or 70s. In large proportion in the feedlot exposure, in the feedlot experience, in order to bring the poundage up. And it did bring the poundage up, but after about 6 weeks, they were getting heart attacks, they were dying, they were dropping dead of cardiac issues. And so they had to stop giving them to that, and they just said, oh, we'll just give it to people then. Lovely, I'm sure that'll work out great. And kale is another one. They used to give kale as feed to sheep. And the lambs were getting stillbirths. There were oxalates, and there's a whole entire category of plant toxins called goitrogens that cause goiter that destroy the thyroid.
I didn't know you had that in kale.
Yeah, so they were causing massive goiters and stillbirths. So these things were getting congenital hypothyroidism and stillbirths and dying. They were born extremely deformed. They had goiters the size of their heads. I've seen pictures of this. And so, we can't give it to sheep because it kills sheep and gets stillbirths. So they give it to cows, dairy cows.
And humans.
Almost. They gave it to dairy cows, and then the milk from the kale-fed dairy cows were giving people who drank it goiters.
Oh.
And then they said, we can't give this to cows, you can't give this to sheep.
Interesting.
So you know what? We'll just give it to people. Why the hell not? And that's the thing. It's just that you can give anything to people and say, oh, this is good for them. And then we have to prove it's bad for people before they stop selling it, just like with tobacco and cigarettes. We had to prove that was causing harm. As opposed to, no, you have to prove that it's good for you before you start feeding it to people. But they're giving seed oils to people, they're giving kale to people, even though they cause serious disease and harm in livestock. And but it hasn't been proven that it causes all these problems in humans, and I think that's backwards. I think you have to prove safety and efficacy first. You don't get to put a drug on the market, and then you have to prove that it's a problem. Like no, that's you're putting the cart before the horse there.
Well, this has been great. I really appreciate your time.
Not a problem.
Hopefully we can do it again sometime.
Absolutely, it was a pleasure.
Again, we will continue this series here at Low Carb USA, and I hope you're enjoying it. We're trying to work on the audio, so if you had problems with it, please be patient. Thank you again. And don't let Tony the Tiger take over dinner. How do you stop this thing?